Good evening, everybody. This is Dr. Clayton Chow. Welcome to another episode of Your Health Matter OC. I'm here with Dr. CK, and tonight we have a very special guest, Dr. Paul Colusi from UCI. He's a clinical professor at UCI Health Department of Medicine, Division of Hematology Oncology. And as we have been advertising, the conversation tonight is around breast cancer. Everything has to do with breast cancer. We've already got a couple email questions. So during the program, if you have questions for us or for Dr. Colusi, please send an email to yourhealthmatters@ochca.com, yourhealthmatters@ochca.com. Let us start with an update on COVID. CK?
Hi, good evening. So good news, as with last time we saw each other, the numbers for COVID have been decreasing, but we still have a lot of people who are in the hospital. So just want to remind people that even though we have low community levels, when you look at the actual number of people who are hospitalized, there's over 124 people who are hospitalized. And also, sorry, I'm going to pull this out. 22 in the ICU. So that's still quite a bit. So even though everybody thinks that we don't need to wear masks, unfortunately, we still have a lot of people in the community who are still getting sick and requiring hospital services. We do have vaccines and the new bivalent vaccine that's now available from Pfizer as well as Moderna. And actually, anyone who's 12 years and older can actually get a bivalent vaccine as long as it's been 2 months after completing their first primary series or their last booster. Here you see the vaccination stats. We still are behind when it comes to the 5 to 11-year-olds. Only 41% received at least one shot, and 30% are fully vaccinated. And in terms of boosters, at least 1 million, over 1 million in our county have received a booster, which is good, but that booster number does not break down into who received the bivalent booster versus the old monovalent booster. Whenever I say bivalent booster, that's the newest booster that has both the original COVID strain as well as the newer Omicron, so it can help protect you against both.
And I think I heard the national statistic for the bivalent is about 7% only. So that is a pretty big concern for us, right? Because that's the reason why we still see people who tested positive for COVID, even though they've had previous booster. So please be mindful of that.
Right, and I still hear that a lot of people are not aware that they may be eligible for the bivalent booster. People thought, oh, maybe it's just for the older population, but it's 12 and up. If you've completed your primary series, you're 12 and up, there is a vaccine available for you. With the bivalent. And we do want you to protect yourselves because we know there's so many different variants now that are smarter than the original COVID that circulated. And so we do need to upgrade our vaccine so that we can protect ourselves against the newer variants that are circulating.
I think the most important piece here is if you are eligible for the booster, please go ahead and get it, especially people with chronic health condition. People who are getting treatment like chemotherapy for cancer, you are at a higher risk for contracting the virus. So please go ahead and do so.
And also family members of those who are receiving chemotherapy need to protect themselves because they may potentially be the one who may be introducing COVID into the household. So we can talk about that later because we can talk about my journey, but it's still very important right now, even though there's low community levels, it's still important to use all the protective measures that you have learned about over the last 2.5 years. This is why you still see me wearing a mask. I realize that I don't have to, but I know that it's one additional protective layer that I can use to help protect myself and my family.
Yeah.
Okay. So I think the next thing I want to talk about is Halloween's around the corner, and usually from the primary care side of me, it's a time for me to talk to parents and families about protecting everyone in the household to prepare for the holidays. So we talked about COVID vaccines, but we also have to worry about flu. Flu has already been circulating in Orange County, even in the summer. And we do know that Australia had one of the severest flu seasons most recently. So it's really important for everyone to get the flu shot. If you're 65 and older, there's a special flu shot for you that you can get at your pharmacy or you can get with your primary care provider. But anyone 6 months and up is eligible for a flu vaccine. So please get your flu vaccine. And we know Halloween is supposed to be, this Halloween apparently is predicted to be a more busy Halloween than we've seen in the last 2 years because there's lower community levels of COVID, but it's also a reason for you to take the precaution of getting your flu vaccine. So get your flu vaccine and your COVID vaccine too before Halloween.
So it's a seasonal flu vaccine. I think that's very clear,
seasonal.
right? And so, I mean, the last 2 years we talked about the trendemic, right? The flu trendemic, meaning at winter time that we were expecting to have a high surge in not only the COVID condition, but also the seasonal flu, but we didn't see it. I think the prime reason why we didn't see that was because we still had a strong mask mandate for the last 2 winters, and I think that's what prevent most of the seasonal flu cases. But as the system getting more relaxed as is related to recommendation for the mask, people are now giving each other the seasonal flu vaccine. So we are expecting that probably for the seasonal flu, we're going to spike just like any other winter before the pandemic. And so in case you're curious, when you go get your COVID booster vaccine, you can also get your seasonal flu vaccine at the same time. And in fact, while you're there getting the COVID vaccine, you should just go ahead and get the flu vaccine as well. It's convenient, and we can co-administer both vaccines, so it's not a problem at all. Surprisingly, I do get a lot of questions from people about that. So just remind you, get your bivalent vaccine if you're eligible, and then while you're at it, get your seasonal flu vaccine as well. Okay?
Correct.
So are we ready to
The last one is monkeypox.
Oh, monkeypox. Okay.
So just
Give
an
us
update on monkeypox. The monkeypox numbers have been declining here in Orange County, but in total throughout this monkeypox outbreak, we've had a total of 246. So only additional, I think about 10 since I last reported this out, and 14 who required hospitalization. So again, those numbers are low. If you are high risk in the population or you've been exposed, we do have vaccine options. You can just go to athena.com for more information. And of course, if you have a rash that's concerning for monkeypox, please see a provider. Please cover it up and see a provider to get more guidance.
But it's good that the cases are dropping, right?
Yes.
So it means that people are really taking precautions. And so if you need any information on seasonal flu, COVID, on monkeypox, please sign on to our website, ochealthinfo.com. ochealthinfo.com. We have all the information regarding these. And we also have a link where you can go and get your vaccine as well. So thank you. So the topic for today, for those of you who are watching and not aware, Dr. CK has been very transparent and outspoken about her recovery with breast cancer. And we are lucky tonight to have Dr. Colucci join us, one of our experts in the cancer area, specifically breast cancer in Orange County. He's famous, folks, I promise you.
Thank you.
And he's going to give you information on how to access his time and how to call and get an appointment to see him. So we're going to give you. He's going to give you that information. We're going to give you that information. But do you want to start us with the statistic a little bit, CK?
Yes.
Well, first of all, I'm so happy that you have recovered. Everything went well.
Yes.
We're going to talk about that.
Yes.
But so happy that you're doing well.
Right. So my journey through this, I had to relook at all of our stats here in Orange County. The good news about breast cancer is that in certain populations, we've known that the incidence rates have been steady.
Okay.
But the newest thing that I learned going through this was that actually Asian Americans actually have an incidence rate, yes, while low, has been steadily rising over the last decade. So that was surprising to me because I was not aware until I started looking at things. But if you see on our screen, they'll pop up the rates that we have here in Orange County for breast cancer. Sorry, I don't have it off the top of my head. But if you look at Orange County and the colors there, we're in that low hundreds range for rates per 100,000 women. So we're doing very well. And then if you look at the next slide, you'll look at the differences with the different ethnicities. So depending on your ethnicity, you can have a different rate or incidence of breast cancer. And you could just look at the slide for those numbers. So it is here in Orange County. The good news is that there's all kinds of detection, and we have mammograms, all kinds of breast centers here in Orange County to help you detect breast cancer. And I think detection is the key to having better outcomes.
So Dr. Calluzzi, from on-the-ground clinical experience and being a breast cancer specialist here in Orange County, what do you see? What do you see in terms of trend? Any typical women, you know, in terms of age-wise, ethnicity, body type? Is there a trend that you could tell us?
I think the biggest message to women is that because you're a woman, you're at high risk.
Okay.
I mean, that's average risk is any woman almost. I think some of the data might suggest it's 1 in 8 women will develop breast cancer in their lifetime. African American women have a higher incidence. I'm reminded what CK has said about Asian women. Probably with immigration to this country, we've seen in most populations that begins to approximate the usual Caucasian incidence with many cancers over time. Just be aware that you are at risk by being a woman, and maybe understand your family history a little bit. But in general, there aren't a lot of specific things that are going to put you at risk besides just, being a woman.
Yeah, because there's a lot of myth that single woman that never been married was more likely to have breast cancer.
Well, we could talk about all those little things,
Sure.
but they're really less important than the first being a woman, the second maybe if you have a breast cancer gene that you've been told you do, or you have a strong family history, which we usually define as mother, daughter, sister. Okay. People that have had radiation to the chest wall. This is something people in the old days got for Hodgkin's disease. Not really done much anymore. Those are probably the biggest risks. And so, you need to be aware of that. So screening for early detection might look a little bit different for those patients. Average risk, there's pretty well established screening protocols. To answer your other question, that I see patients all the way from the age of 23, my youngest patient most recently, to 95.
Wow.
We're learning more that age is less important. It's probably the genomics of it or the genetic makeup of the tumor that's a little more important, although age still plays some role. But it across the board, we see patients, multiple ages. Most patients, however, the peak incidence is between 50 and 70.
Yeah, but I think I remember when you first found out and you called me, we were both surprised, right? Because you young.
Right.
Still.
I have to admit, when I learned that there's a potential, like when I first heard that my mammogram was abnormal, at first I was not too concerned because I do have a history of a lot of different lumps on my breast. So I've been going for regular checkups. So I wasn't surprised about that. I was just thinking, oh, this is yet another probably just lump on my breast. It's fine. But, when we did further workup, that's when it was my first time hearing a calcification. So that's very different from my previous workup. And so I am a physician. I've walked many patients through this journey. So as soon as I heard that, and then also there's some other things that, were said that made me start to think this is probably cancer. And so when I first heard about it, I think I was a nervous wreck, and I was shocked because I don't have a family history. I don't have an immediate family history of breast cancer. If anything, it's, an aunt of a very far off relative who has breast cancer. So not my immediate family or the next generation outside of that. I've done everything. So the myths about, if you're not married, you're single, you never had a baby. Well, we do know that if you breastfeed right? It can help mature the breast tissue. So it can reduce your risk. It can be a protective factor. And I purposely, actually, if my mother's watching, I purposely actually got married and tried to have a baby before the age that, you know, just to make sure I can reduce my risk further.
Is that your confession right now to your mom?
I did
or to
already.
your husband, the reason why you marry him because of that? No, but the other thing about you, though, is that I was surprised because you were pretty active and healthy, right? You watch your diet and you exercise. Not that it has anything to do with it, right? But we tend to believe that people who live healthily, right, have a lesser risk. But I'm so grateful that you said the fact that you are a woman, you're at risk.
Right.
What about us men?
1% of breast cancers are male.
Okay.
So occur in males.
That is not an insignificant number.
We'd have to do the math. I mean, it's small, but yeah, I mean, it's real. I mean, if you do have a lump, it should be looked at. I mean, that's always the message to everyone. If there's a lump or something unexplained, to please have somebody look at it and do the workup.
We do have a video to show you to talk about a little bit about risk factor of breast cancer and then also self-examination. But we're going to come back and talk about that. But let's take a look at the video.
1 in 8 women will develop breast cancer over the course of their lifetime. So what can women do to lower their breast cancer risk? Well, joining us now to teach us some tips is our friend, board-certified breast cancer surgeon and physician, Dr. Christy Funk is in the house. Dr. Funk, Christy, it's been way too long. How are you, Doc?
I'm great. How are you?
Good
so
to
great
see
to
you.
be here.
So let's start with dense breast tissue. Why is it so important for women to know if they in fact have dense breasts?
So having dense breasts both elevates your risk for getting breast cancer while at the same time making it harder to detect said breast cancer, making it very difficult to read mammograms. So understand this, dense breast tissue on a mammo looks like splotches of white everywhere, and fat is dark, but cancer is also white. So now we're looking for a snowball in a snowstorm. In fact, the densest breasts miss up to 50% of breast cancers.
Dr. Funk, I grew up in a family with 5 sisters, and so this was a very important topic in our house. How can a woman tell if she in fact does have dense breast tissue?
So a woman can't tell by feeling. She may feel like lumpy and think I'm dense, but actually it's visual. So we look at a mammogram and grade density using a scale A through D. There's a very specific language on your mammogram report that all radiologists use. So it's like a density code, and I'm going to break it down for you. All right. So predominantly fatty breasts have less than 25% density. So it's mostly dark, whereas scattered fibroglandular densities means that 25 to 50% of the tissue is dense. Both of these categories are considered not dense, and 50% of women end up there. Now, onto the dense breast. So class C, heterogeneously dense, 50 to 75% of the tissue is white on imaging. And now you can really see how a white cancer can get missed amidst the haze there. And now class D is extremely dense with 75 to 100% white density. So 50% of women have dense breasts, with 10% having the densest D class.
If you in fact do have dense breast tissue, what can you do to improve cancer detection?
I advise all women with dense breast tissue to get a 3D mammogram, aka tomosynthesis, which when going head to head against your typical 2D mammo, will find 34% more breast cancer with 17% fewer callbacks for false positives, which is like when they're, we see something, but it might be nothing. And at the end of the day, it is nothing, but you're like, oh my gosh, that was stressful with the extra views and biopsies. So 3D mammograms for everyone dense. Now, for women with implants or those at high risk, maybe they've had a biopsy showing atypical cells, they have a strong family history or a gene mutation. For those ladies, let's add whole breast screening ultrasound every year. And at the highest risk ladies, I recommend a breast MRI.
Gotcha. Okay. Now, Dr. Funk, talk to me about lifestyle changes. What other changes can women make in their lifestyle that can help reduce their risk for breast cancer?
science confirms that there are many things you can do to reduce your risk of breast cancer, including eating a whole food plant-based diet. So you want to avoid or minimize meat, dairy, saturated fat, simple sugars, processed foods. Number two, minimize alcohol. The International Agency for Research on Cancer, which is a part of the World Health Organization, has found that for every 10 grams of alcohol consumed per day, so about 4 ounces of wine or a half pint of beer, the risk of breast cancer increases by 7 to 10%. Wow. Number three, exercise regularly. And four, lose excess weight. I've teamed up with the Physicians Committee for Responsible Medicine this October to bring you the Let's Beat Breastcancer.org campaign, where we encourage women to follow the 4-pronged approach using those 4 lifestyle factors to beat breast cancer. And we send you fun newsletters. You get a free digital goodie bag and chances at giveaways. Sign up at letsbeatbreastcancer.org.
Welcome back to Your Health Matters OC. Tonight we're talking to Dr. Paul Colusi. Actually, CK and I are talking to Dr. Colusi about breast cancer. If you have any questions, please send us an email at yourhealthmatters@ochca.com, yourhealthmatters@ochca.com. So that video was pretty comprehensive,
Yes.
but can you just walk us through simple, right? What kind of detection should a woman or the 1% men should be pay attention to regardless, right? Very basic. Sure. What do you need to do, and what is the frequency?
Sure. So I think the first most important thing is if you feel a lump, it needs to be worked up differently than if you're doing just screening. So if you are a woman or a man who feels a lump, you need to let your doctor know. They need to order what is called a diagnostic mammogram and probably ultrasound, which was alluded to in the video. So that's a different thing than a screening mammogram.
Okay.
So a screening mammogram is only 2 views of the breast, oftentimes done 3D, most places now. At UCI, that's what we have. You will do screening mammography starting at the age of 40, probably yearly, until the age of 70. I think it really kind of depends on risk to a certain degree, but a baseline at 40 is very reasonable. The peak risk is between 50 and 70, so some women choose to do a baseline and then not again until 50. In all honesty, this is something you should have a conversation with your doctor and your provider with. If you have dense breasts that are alluded to, you may need it more often, and you may need other modalities like ultrasound and like MRI. That will then play a role. What happens is the radiologist will actually calculate your risk of developing breast cancer, called the IBIS score. You could ask them what it is, and if it's really high or you have dense breasts, it may recommend things like MRI, ultrasound, or frequency might change. So, we work on a team. I work with a breast radiologist, a breast surgeon, and myself. So we kind of have some understanding of all these different areas, but you should really ask, usually, your radiologist to give you some information about what's the best screening plan in addition to your primary doctor.
So
I want to clarify one thing, because I know I got a lot of questions about this. People want to get away from doing the mammogram and just want to do an ultrasound, but my understanding is it's mammogram plus ultrasound to help out. Is that correct?
Correct. One can't, ultrasound cannot replace mammogram. So ultrasound complements mammography. So the traditional way this would happen is you'd have an ultrasound, you should have a mammogram, there's an abnormality, it's followed up with an ultrasound to see if there's actually a mass that can be detected. That would be the case. The ultrasound itself is not adequate, and it's not reproducible. So from year to year, you can't map the breast as easily. So there's some technical reasons.
You have nothing to compare to.
There's nothing to compare because the way the imaging is actually done, ultrasound's kind of it's not a static experience where the mammography is, so you can't compare.
No, I hear this all the time, and I actually have women in my family that are afraid of getting mammogram, right? And so there's 2 scenarios, and actually one of our viewers just sent an email asking, what do you tell women who are afraid to get mammogram because of the radiation risk with the mammogram, number 1, and number 2, that because of their body size or body configurations, that the mammogram itself is very not so much painful, but very uncomfortable. I remember when my mom, at the age of getting her mammogram every year, and every year she was dreading it because she said it's so uncomfortable because of the way her breast is, and they squeeze and they make her so uncomfortable. What do you say to women like that?
Yeah. So I think the technique's improved over time. So I do think there's less pain and less discomfort. I do think 3D tomography is a little bit easier and faster. So I do think that's improved. The radiation exposure is considered to be safe, particularly if you follow the guideline from 50 to 70 yearly, and then 40 as a baseline, and then as often between 40 and 50 as appropriate based on your specific clinical scenario. I think the risk is relatively low. Okay, so I think that considering that early detection is really important to helping women make decisions early if they do have breast cancer, I think the trade-off is there. So the risk-benefit favors mammography.
Okay.
And I can tell as a woman who's gone through mammography that the newer machines are more comfortable, and it's really quick. Yes, it's like a pinch and it's not comfortable. You take a breath, they take a picture, and then it's over. So I think the way they've changed the machine has been more comforting for women, and compared to everything else I've had to go through, that was nothing. So it's all relative.
I can tell you 1 year, my mom had just finished her shoulder surgery, and she needed to get her mammogram, and she was late for her annual mammogram. And I had to go with her, right, because just to help her maneuver because and I was standing there watching it. I'm a physician, and I look at the way they manipulated to get her breast, get her mammogram, get her breast picture. I was like, ouch! I feel the pain on me too, right? And the technician was very kind, very gentle, but I can't help but feel pain on my own. So I know, I get it, but I think that the risk of not getting it done is far outweigh that discomfort in the 15 minutes or so. So thank you
Absolutely.
for clarifying that. Let's talk about your personal journey, right? So there was a question from the audience that said, how do you, from a patient perspective, tell your family in a way that they are supportive and understanding and not completely freak out?
Oh, that was the most difficult piece.
Okay.
So when I thought that I would be getting the diagnosis of cancer, my biggest question is, how do I break it to my family? How do I break it to my husband, right? Like, I've got 2 kids. They're middle school and high school. I have to admit, I had to take very long walks to calm myself down, because as I replayed every scenario of how I'd break it to them, it just hurt. It hurts, right? Like, how do you tell your loved one you potentially can have cancer? Because cancer is a very emotional diagnosis. And I knew that good news is it was early detection. So chances were I was going to have a great outcome no matter what it was. We have great resources here in Orange County, but I took sometimes 2-hour walks. I told my husband I couldn't go home. I just had to go for extra exercise. And then when I finally had to break it down to them, it's just so difficult. I actually couldn't. I was actually at a conference when I got the biopsy results, and I had to tell my husband. I actually didn't even tell him. I just said, "Hey, we're getting a dog." I got my results for getting a dog. I need a therapy dog. So that was his answer, and I don't even know how he handled it that night. He ended up telling the kids, and I know that they were thinking that something was going on, because Mommy was taking very long walks for the last couple weeks, and then on top of that, I completely changed my diet so that I was eating even more healthy than I usually do. I already eat healthy, and I was eating a whole lot of cruciferous vegetables, lots of broccoli, and no meat whatsoever. And so they knew something was up. The good news was the kids are actually more resilient than we think. And the youngest one asked so many questions, which actually was positive. I was surprised. And they actually pulled all their knowledge from school, from what they were hearing from the doctors who have visited about So a plastic surgeon apparently visited my older son's school at one point and said, actually, it's not like what you think in Hollywood, where everything is about just implants. Actually, most of their reconstruction is for breast cancer or cancers. So he was actually asking from that perspective. So there was a lot of great dialogue in the beginning.
And the audience need to know that both of your kids are in high school.
One is in middle school, one's in high
One's
school.
in high school, yeah. So that's impressive.
Yeah.
Dr. Colucci, what do you tell family so that they can be appropriately supportive of somebody who just got a diagnosis of cancer? Right? Any kind of cancer, but for breast cancer particularly, especially it changed, I would imagine, it changed a woman's life entirely, right? So we'll ask you that question, but let Dr. Colucci tell us.
So, I think for some of it has to do with, if it's advanced or not, but the majority of the patients we see are not. They're early stage 1 or stage 2 that are going to be very easily treated, and easy for me to say, having done it and not being on another side of this, with surgery and possibly radiation, and sometimes as simple as an anti-estrogen pill. It could be that simple. Someone may need chemotherapy. The message I always tell people if they need something more like chemotherapy is things have improved tremendously over my career. I mean, people are really now able to tolerate chemotherapy really, really well. We also have some very fancy genomic tests that will tell us specifically what the prognosis is and what you actually need to do. So I think we can be more precise. So I think the message almost always is that, you're going to do well in early stage breast cancer. And now even in advanced stage breast cancers, with the advent of Herceptin and a variety of other agents, we see people being cured that wouldn't have been 20 years ago. So I think the message in general is that there's hope for cure, and there's hope, in fact, for this to be relatively easily tolerated, but some commitment of time, depending on what the treatment requires. Yeah. So I think that's something nice about breast cancer. In general, we have very good outcomes. And the incidence of dying from breast cancer is significantly diminished over the years.
And what can you help the patient by, what is it that you would tell their family member, right? But obviously, I would think that if I'm a woman, if I was your biological sister, I would worry about my own risk, right? So what do you tell their family member, the patient's family member?
About risk or about...
Yeah, about risk or about what they can do to support the patient.
Yeah, everybody's experience is different, so CK is going to have to tell us that. But I think the message to most family members or friends is just listen to the patient.
Good.
Give them time and space. Okay. Don't push them for things. Don't drill them on what happened at the doctor's and what was said necessarily. And just ask, how can I support you?
Great.
Those are probably the best things that you can do. Be non-judgmental, listen. That's what I would tell most people. And also, I always tell people, don't, when it comes to themselves, if they internalize this fear that it might be them, remember every person's situation is different. So you always have to be a little bit cautious and just kind of say, hey, we can look at that separately or whatever with you. But for the most part, stay focused on family member or friend.
So what was helpful that your family did for you that you find helpful, or you wish they could have done differently, or if any?
I think what was helpful was when people just came and helped, when they came to drop off food, or when they came to actually check up in person, right? Or when they allowed me to tell my story rather than digging in immediately. Exactly what you said, listen, right? They actively listened and just waited for me to be ready to talk. That was really helpful. Yeah. Giving me space and time and knowing that it's not them if I want to be quiet, right? If I want my quiet place, if I need to do my meditation, they know that it's nothing against them. Mommy's just trying to balance herself out. So I think that was really helpful. And sometimes it's not even talking, it's just being present. That's all that's needed. So even those small gestures, I'm not a hugger, but hugging all of a sudden became very important because it's that physical touch with others. And then my kids, they did such a great job just talking about regular stuff, not really focusing on the diagnosis and telling me about their day. So it was a great time for us to reset. it was like the summer I didn't, I never planned for. We had every day together. So it was really wonderful.
I have to tell you, the day that you told me that, I went home and I was down. And my family, they're watching. And one of my sisters said, what happened? And I said, I can't believe it. CK just told me that she has breast cancer. And they were shocked. They said, isn't she very young? And I said, yes. And my sister, who Dr. Calusi knows, she's watching Patty, said, oh, tell her she needs to see this and that. Of course, Dr. Calusi's name came up. And I said, I think she's seeing oncologists at UCI. It could be. It's probably him. So he said, yeah, let me know. If she want to talk to me, she can call me because she's worked in this field as a nurse. So, but I know the day that you got surgery, I was sitting in needle and pin. It's like, okay, how did the surgery go, right? What have you? And I believe your husband texted me and said, she's out of surgery, everything went well. And I had a sign of relief and I texted him, thank you. But so that your surgery was on Thursday. And then I was debating, okay, when should I call her, right? And come on, folks, I'm a psychiatrist, a shrink. And I was like, okay, when do I call her? And I want to give her space, and I know that I understand that she would need time to recover, right? So that was Thursday, Friday. On Sunday, she FaceTimed me. And when I saw her FaceTime, I was in the middle of something I can't remember. I said, okay, I got to go. So I have to talk to her. So we FaceTime each other, and I was so happy, and she was FaceTime. She jumped into work, talking about work for 30 minutes. I couldn't stop her. And in my head, I said, how do I tell her, girl, you need to shut up. You just got out of surgery, and you're talking shop. You're supposed to be not talking about work. But I remember we talked about this, and she said, Clayton, I'm looking forward to come back to work, and that's how I am. That's how I cope with things. And my psychological understanding said, no, you need to rest, right? So finally, after 30 minutes, I said, CK, you got to go now and recover. I got to go, but don't talk work. You just got out of a major surgery. But I tell you, it was such a relief. And as a friend and a colleague, I also struggle on how do I support her, right? And then come to find out when she was FaceTiming when we ended, she said, oh, my husband is right here. And I was like flabbergasted. You just got surgery and you talk to your boss. I was wondering what your husband would say, right? You need to talk shop, you know what I mean? But that's how people cope. The point is, different people cope differently, right? But how would your family cope before and after? I mean, if you don't mind sharing that, especially your partner, your husband.
I think it was difficult. I think, and luckily I spoke to, so people come out of the woodworks when you finally open up, and I think that was the best learning that I had, because at first I thought maybe it's best to keep this private, because I didn't want to burden anyone with my diagnosis. This is my journey. This is my burden to handle, right? It's not for me to share with everybody, and then everybody gets worried. But when I finally started sharing, people really opened up. And there's a lot of people who came in to support. So an old friend I hadn't talked to since undergrad called me up and told me her journey. She's about my age, and beginning of the pandemic, she came down with breast cancer and had to go through everything, radiation, chemo, surgery. And she had 2 kids who were even younger. Wow. And she already warned me that, well, we have a fighting spirit. Both her and I, we have a fighting spirit. So it's just find a solution, get a plan, and get moving. But realize that not everybody around you handles that the same way. And so she already warned me that the number one thing to look out for is my immediate family and their emotional health. Take care of myself, of course, so that I can be strong throughout this, but also realize and be sensitive that they may be struggling, if maybe the same, if not more than you are. So that was really the best advice I received right before the surgery. And so I was looking out for my husband, and there's a lot of things that happened. And again, it's really hard for everybody. And I have to admit, guys don't show their emotion. They don't talk about things. And so it can show in other ways. So I think the dog has really helped our family. We got the dog before the surgery, and I think it helped distract everyone. And having family, grandparents around to really help was also great. And then friends who also came. So I actually talked to all of our very close friends and told them, my worry is my immediate family. Please take care of them. When I am at surgery, when I'm in the hospital, please look after them. So we had friends who actually came over to look after my family in terms of the young kids as well as my husband. So we had a great support in that manner. Not everything's perfect. Not everything's like the movies. I have to say it was a little bit messy at times. But at the end of the day, everybody had the right intention to really support us.
So Dr. Calusi, I understand that you work in an environment that you have interdisciplinary team, right, and you really take care of the patient as a whole person. First of all, give us the phone number for those who are watching who want to go into your care. Give us the phone number, and then talk about your program, your clinic.
Yeah,
center.
Of course. The number is 714-456-8000. So that's the Cancer Center call center. So you can get a hold of us that way. Our breast centers, we have several, but basically breast surgeon, breast imager, and myself, and other medical oncologists also. So we kind of work as a team, so it's really nice. We're able to see people oftentimes the same day. Patients, most women, when they come for screening mammography or imaging, will get a report from the radiologist that day, so they'll have an opportunity to consult. And then if they need to have further follow-up and workup, it's kind of all right in the same area. You know, we have access to integrative health through the Samueli Center at the medical school. We have social workers available, nutritionists. I think it's really the core team that makes a really big difference, particularly up front, because those are the people that are really going to be working with the patient. And it's nice because we're all kind of cross-trained, so we all kind of know what each other's going to say. So I think it's consistent with the patients. They hear the same thing. And I think that's a really nice environment.
Well, I think it's very important, though.
Yeah,
right?
Absolutely.
Because I know when she come back and told me that her experience, I think, was after your first meeting with the team. She came back and she said, "Oh, I'm so comfortable. They're so great. They explain everything in detail and consistency." I think that's very important.
Yeah, I think it makes a big difference. So when you're with the same people that you work with all the time, you're able to talk to your colleague about the patient. So you kind of have some commonality. You know what the plan is going to look like. Yeah. And I think that's really nice. And it's something we do. So
we're going to jump into treatment a little bit. But before we go there, we have a video clip that talks about surgical treatment and other treatments, such as chemotherapy and radiation, etc. So let's take a look.
Hello, I'm Kazuaki Takabe, Clinical Chief of Breast Surgery at Roswell Park Comprehensive Cancer Center. So breast cancer, we treat with multidisciplinary approach, meaning not only surgery, but medical oncology to treat with drugs and radiation oncology to irradiate the body. Especially for early breast cancer, it will be surgery to remove the cancer. For those larger tumors, we may treat with drugs first to shrink the tumor to do the minimum surgery, but yes, we do need to do the surgery to confirm the effect of the drug. Radiation after the removal of the whole breast depends upon how extensive and how spread the cancer is. If it's spread to the lymph node, yes. If it's confined to the breast and nowhere else, oftentimes no. So not only about the size or the looks of the cancer, we're gonna analyze the gene expression of that cancer, and we're gonna precisely analyze how aggressive this cancer is, which will determine whether the patient does or does not need chemotherapy. Now the good news is, just 2 years ago, the latest research came out that tells us that 70% of all the early breast cancer that has not spread to the lymph node does not need chemotherapy. This is very different from the previous practice. In the end of the day, the biggest challenge is that we still lose 40,000 women by breast cancer every year in this country. We lose them because they develop metastasis and recurrence. Therefore, the ultimate goal is to reduce or help those metastatic breast cancer patients. Those are the patients that we are striving to develop this new approach to prolong their life.
Welcome back to Your Health Matter OC. Tonight we are talking about breast cancer. With us is Dr. Paul Colusi from UCI and obviously our beloved CK, who's just gone through treatment and in recovery from breast cancer. By the way, if you just missed us, you can also rewatch us on our YouTube channel, Your Health Matter OC, or our Facebook. You can watch it immediately after the show's end. So if you have any question for us, you still have time to send in an email to yourhealthmatters@ocHCA.com. So Dr. Colusi, in very simple terms, can you explain to the audience what treatments are available now?
Yes. So I always tell patients there's two approaches to breast cancer. There's the local treatments, and then there's the treatments to prevent spread to other parts of the body, what we call systemic therapy. So a surgeon is going to consult with the patient primarily on the local control measures. The message for simplicity's sake is you can have full removal of the breast called a mastectomy. It's the same exact outcome as survival if you have a lumpectomy, usually followed by radiation. There's some exceptions about radiation, but in general, lumpectomy plus radiation is the same as mastectomy outcome. So once that decision has been made, in most settings, that will then come to me, the medical oncologist, and I'll have all the information I need to make decisions on what is the potential risk for distant disease. That's where we give anti-estrogens. Chemotherapy may play a role. And we're finding more and more, less and less chemotherapy and more anti-estrogens and approaches that way with the advent of the genomic profiling that I mentioned to you. So I think we're actually finding less is more. Less surgery is the same outcome. Less chemotherapy and more endocrine therapy or anti-estrogen therapies is better.
And the survival rate, I think you mentioned earlier,
is improved.
So much
and probably the important part to remember, the main drug that's created that, that's driven that, two drugs, is tamoxifen or another drug called anastrozole. Those two drugs, you will see definitely the curve around 1980 dropping, 85, and then with the advent of Herceptin in 2000. So you really see kind of two major pivotal points in the treatment. I think if you talk to a lot of women in Orange County, they all know what tamoxifen is. It seems like you run it, they've all heard the word,
right.
Or they know someone who's been on it. So it's very well established, been used for at least 50, 60 years.
As hopeful as it sounds, it must be difficult to make that kind of decision, right? Can you share a little bit on how you...
So how I approached it was I already had lumpectomies in the past, and my biggest concern was, is this more than DCIS? Because there was a microinvasive component. And so for me, and again, everybody's answer is different and everybody's journey is different. But me at my age and my stage in life, I made the decision that for my mental health and peace of mind, I need to at least remove that breast. So that's actually what I did. And then I underwent reconstruction, and I never thought I would undergo any type of reconstruction ever, because I thought I'm happy with my body, I'm body positive about everything, but this was a very different type of journey. I think when my concern was, if I'm reminded every day of my life afterwards of cancer, how does that treat you emotionally? It's so important to keep your mental health in check. And that's where, for me, the answer was to do reconstructive with my own body. So,
in your process of decision making, who did you involve besides obviously Dr. Colusi and his team? Who else did you involve in your decision making process?
My husband, and then of course my doctors, and also some of my old med school friends, also surgeons and primary care doc, but. I think at the same time I had the knowledge of already walking a lot of patients through this. So I knew, and I know my personality and what was right for me. And so it was almost an easy decision for me to make. I think the harder decision was afterwards in the recovery. What do I do next? Or what do I look out for? And luckily, knowing that mental health is so important, I immediately, after a friend actually told me, hey, I know you're doing well right now, but consider seeing a therapist specifically for this. And I actually did, and that was very helpful because the journey is rough. It's a roller coaster emotional ride from the beginning even to now. Even though I'm recovered, I feel like I'm almost fully recovered from the surgery. It's still an emotional ride. And then I actually decided to join the recovery group, which I felt was really helpful to be surrounded by other females who are going through the same thing. And that's actually how I met Dr. Kaluzzi. Right. I think getting a second opinion and getting other voices to make your decision about what to do going forward is very important because it makes you feel even more comfortable with whatever decision you're going to make.
Talk to us more about that group. Where can people find it?
So actually, I reached out to the Susan Samueli Center because they have a breast recovery group.
Right.
But there's a lot of other. So all the bigger health systems have their own groups. Hoag has a group. St. Joseph, Providence, Memorial Care. They all have their groups, support groups. But this one was a recovery group that's more a little bit on the integrative realm, which I'm passionate about, looking into health and lifestyle and diet. And so I felt like this fit for me.
How important is that? Because I heard you mention about it, and I was very impressed about that. Right, the integrated approach.
Yeah. So I think from a simple perspective, the message is mind, body, spirit. I think it's all of those things together, because I think even just more information, better decision making, more confident decision making is one piece of it. I think there can be nutrition. We know in estrogen positive breast cancer that diet and exercise do make a difference to long-term survival and outcome. And then there may be another spectrum of things that are more in the realm of kind of, I think, quieting the mind and getting centered. So mindfulness, meditation, massage therapy. So I think there's a lot of things, movement. So in that respect, they're really all complementary for mind, body, spirit. And I think everyone's a little bit different, but the Samueli Center does those sort of things and provides that sort of education and training. They do some other advanced sort of integrative naturopathic approaches too. But I think in general, I tell people to keep moving, exercise, keep your body to ideal body weight if you can. Cut yourself some slack if you can't do that necessarily, because some of the medications kind of create some challenges. And I think also view it from a positive perspective. Understand your prognosis and really try to move through that. Because I have patients, honestly, who have not such great prognosis, but have great outlook. And some that are paralyzed with fear with a really good prognosis. So I think you have to work with yourself and your therapist and your doctors to kind of understand that, because I think that's important to the healing process.
It's such a refreshing thing for me to hear that, a medical specialist like you encourage people to seek out therapy, doing mindfulness and what have you. I mean, is that common?
I don't know. I kind of see myself as a healer. Okay. So I see myself as a role of educating people, coming up with the best medical and scientific advice, but kind of seeing that as I'm part of their journey. It's not all about me. And I think, unfortunately, some of traditional allopathic medicine is about the doctor, the disease, and the focus on that, as opposed to all these other pieces that kind of fit. So I think we have to acknowledge that people are multidimensional. People do mindfulness and meditation, whether they realize it or not, by going to church and praying. I mean, these are all things we don't necessarily talk about. I've always just been interested in that. But I think we need to be more aware of it. And I think that's what we try to do more in the modern oncologic realm. At least I hope so. Right. That's what I try to do.
So you are a county health officer, right? I mean, public health is your thing. Okay. Obviously, all of this is great, right? So if I'm a poor woman, how do I access all of this, Dr. CK? I'm not going to put Dr. Kaluzzi with this question, but how do you think people can access all of this? Because it sounds wonderful.
Right. So first of all, find out what resources are available to you. If you don't have insurance, you can call our hotline 211. You can find out more information. We do have CalOptima, who you might actually be eligible for. And then there's great cancer organizations that if for whatever reason you're still not covered by all the resources we have in Orange County, there are organizations that will help connect you or help with financial needs or other resources. So again, there's many different ways to approach that answer, but I know that there's many resources out there now for people who may not have insurance.
Yeah. So I think one of the things, I don't know if we've listed in the resources sections or not, but the American Cancer Society is where you need to go. I know even for the Asian community here, there are local chapter cancer association or nonprofit organization that can help you out. So I really, really encourage you to seek out all of this because this is what's needed, right?
Absolutely.
I mean, we in America, we just talk about this before the show, is that everybody looking at, gosh, this is the place where whatever that you need, you can get. But you just need to know how to navigate our system because our system is unfortunately, a bit complicated, right? So thank you for sharing that. Dr. Calluzzi, what is the main takeaway point that people should get from you for this show?
I think be aware of your body. If you feel an abnormality, please see your provider. Make sure that they then do the appropriate workup and that you get an answer that makes sense to you and to the provider. I think also not to be afraid of breast cancer. That's maybe the main message, is really there are so many new advances in surgical technique, radiation technique, anti-estrogens, again, less chemotherapy these days than before. And actually the chemotherapies that we're using now are much more effective, even for the more advanced cancers. So I think don't be afraid, and definitely do screening and understand your risk.
I agree with everything you said. I think this cancer diagnosis was a great reset button for me. It helped me reprioritize what's important in life, and actually have a more positive attitude going forward, and actually putting back into place a lot of the lifestyle, kind of fine-tuning more of that lifestyle and diet and exercise. So that was really nice. So it doesn't have to be a doomsday diagnosis.
Not at all.
There's so many opportunities. I've made so many more pink friends. I'm sure some of my pink friends are watching now. And actually, it does take a community. It takes a village to come together. So I'm really thankful for everybody who's come together to support me through this journey. Lots of family, relatives, neighbors, friends, coworkers. Everybody just came together and showered me with love. I know I'm fortunate to have that, and some people don't. So I'm hoping if you're one of those people out there who's been keeping this to yourself, I personally felt it was harder to keep the diagnosis to myself. It was a huge burden on my shoulders. And when I finally let go and I finally released that information to my loved ones and my friends, actually the burden was lifted and I felt more positive. I felt like I had opportunities to share and I could cry if I wanted to and didn't have to hide the fact that I was carrying this diagnosis. So hopefully you can find friends or family or join a support group. So if you don't feel comfortable telling your friends or family, join other people who are going through this.
And from a family and friend perspective, how can they most effectively support a loved one with cancer, specifically breast cancer?
Just be there, just listen, just be present. You don't even have to give advice. If anything, it's better not to give advice and allow the person who is with the cancer diagnosis to tell you what they need. Just being present.
Yeah, I tell you, this is very hopeful. I thought I was going to cry, but it is just so hopeful. The two of you just make this show to be very, very hopeful, which I think more than I expected, right? Because we talked before the show is that from a cultural perspective, and even the American culture, we still have this fear about cancer and we don't want to talk about it and we think that it's something really bad. But thank you for making
Absolutely.
it so hopeful, because if people feel hopeful, then they would be much more courageous in doing all those screening, all those self-examination for early detection, because there's hope. I mean, as you said, the treatment has improved our survival rate so much. So thank you so much
Absolutely.
for doing that.
The other thing I learned from my Pink Sisters is to celebrate. Celebrate every milestone. So actually, I did celebrate one of the biggest milestones, which is 3 months post-cancer or surgery, whatever you want to call it, and actually was surrounded by a lot of other pink people at the recent Komen Walk, actually, in Newport. But there's many other activities going on throughout Orange County to support.
So seek out support. First of all, seek out education, right? And then do early screening, right? And then if you have cancer or you have a diagnosis, seek out a team approach, a treatment provider like Dr. Calusi, a plug-in for Dr. Calusi. And then also find community support, right? That's what you need. And don't be afraid. And for those of you who have loved one that come down with breast cancer, support your loved one. Look at that, I went out and I bought a tie to support CK. So thank you so much.
I was hoping that they could show some pictures from the recent Komen Walk, because we actually were able to raise a lot.
Yeah, so thank you everyone for tuning in and watch us for this very important episode. In 2 weeks, on October 18th, we're going to come back and talk about lead poisoning, because that is the National Lead Poisoning Week. We will be talking about where lead is still found in our environment, and how do you prevent our children from being poisoned or exposed by lead. So between now and then, if you have any question, send us an email at yourhealthmatters@ochca.com. yourhealthmatter@ochca.com. Thank you so much. We'll see you in 2 weeks.